fleeting, and it's something that needs to be protected, or in this case, restored. Joining me right now is Dr. Fidel Barbosa from TurningPoint Dental Implant Center, and also Duston Roszina, who, I'm sorry, we moved the pillow for Dustin, but he's incredibly disappointed. So we may have it as a take-home prize for you in a little bit. But first of all right, we'll put it here. If you want to hold it, that'll be fine.
Oh, thank you.
I like the fact that Dustin is smiling, but Doctor, explain specifically an implant dental center.
So we are TurningPoint Dental Implant Center. We're at Keystone at the Crossing area, and we do dental implants. Dental implants are a way to restore teeth in a permanent, non-removable, and now with TurningPoint affordable manner. We can provide patients most of the time the same day with full arch of teeth or just a single tooth.
Same day, really?
Same day, in most occasions.
Wow. What was your situation?
Well, I have actually had pretty much only one good teeth I had. Everything else was rotted. I had a lot of infections and things like that, and they approached me.
Was that just through neglect? I don't want to judge you as a person, but I mean, I don't know your situation that well.
Well, actually, I was in the Navy.
Okay.
And they did a lot of fillings. And
oh, all right.
The person that did the fillings was a student.
Okay.
And they left a lot of pockets open. So they had basically rotted from the inside.
And then that just led to eventual deterioration?
Yeah, you know, and like you said, you know, there is a lot of people that have different things going on in their lives, and they don't even realize what they're doing to themselves. They don't even realize what actually that is doing to who they are. And they get to a point and something triggers, and they decide, you know what, this is enough. This is not me. This is not how I want to live. This is not how I want my daughter to perceive me.
Was there a trigger point for you?
Yeah, 4 years ago, and my daughter, actually all my kids, but my daughter just finally said, why are you so angry?
Oh, wow, kind of an intervention almost.
Yeah, well, because I always looked mad. I was never smiling. I was just, like in the photos when my daughter graduated, it just, I had this frown all the time. I mean, I could never show
Bring yourself to do that.
Yeah, how I looked. And I perceived that with all the other, everybody that had met me, I thought I was, you know, always angry. Even I lost a couple jobs because they just, you know, just not meshing. You just seem like you're always angry.
Well, I never would have pulled that pillow away had I thought you were an angry person. But it's not just quality of life and demeanor. There's also health aspects to not having
Absolutely, and we were just talking about this morning. I mean, he's brought some things to my attention that have changed in his health. You know, health is an all-encompassing thing. I think that your brain, your perception of your own life has the potential to affect who you are, both emotionally as well as physically. And not having to deal with constant pain in your life. And actually, we were looking at pictures today, swelling in his face, and things that he couldn't even recognize were coming out of his mouth.
Not realizing it was a result of that.
And getting rid of that situation and allowing him to be himself and just behaving like if he was a teenager or a 20-year-old kid, it makes your life feel better. It makes your heart work better. It makes your whole health situation much better.
Was it fairly instant after the appointment and having had taken care of?
Actually, I talked to another person that had the same procedure done, and we both, like, same thing. It was like the next day. We were out, and just so much confidence. There's things that we wanted to tackle that we haven't done for so many years before. So you just get this overwhelming energy of just wanting to take on the world.
Wow. We do have some